What's going on, everybody? Welcome to the Jiu-Jitsu Therapist Podcast. My name is Eugene. I am your host, and today I am joined by my wife, Misha Tsozik, who is a licensed massage therapist, and we actually discussed one of her classmates that she does silks with, actually one of the instructors. She is dealing with some shoulder issues and has been diagnosed with a labral tear. So we talk about the different types of labral tears, the process of diagnosing the tear, recovery, surgical interventions, and just getting back to sport and activity. So hopefully this helps you guys. If you have some curiosity or some interest in learning about the recovery of a shoulder surgery, since it is a pretty difficult recovery and a pretty extensive lot goes into it. So I hope you guys enjoy the podcast. Thank you for sticking around. Appreciate it. What's up, Mish? Welcome to the podcast.
Hi.
Hi. Random. How you been?
Good.
Good?
Busy.
Yeah.
Busy. Dealing with work and
Yeah, it's always fun.
the baby and
So you wanted to talk to me about like some kind of injury stuff. You had some friends approach you about.
I had a girlfriend, Terry Kendall. Hi, Terry. She was asking me to pick your brain about the slap tear and
Okay.
what specifically you know about it. Pick your brain about that, and then she's suffering from one now. So
Yeah.
her recovery, the surgery, and then the recovery on the backside of that, and what that looks like.
So what was like, as far as background goes, what was, do you know what her mechanism of injury was, or?
Well, there's no specific traumatic injury that we know of, so it seems almost like chronic overuse, probably.
Repetitive. What did she do?
Repetitive. So she's an aerial athlete, and she does silks and rope and trapeze, and she is also an instructor. She owns a company that travels and performs, so she's more on the advanced side. So she's doing this a lot and often.
Okay.
So that's kind of the background to it.
How many years has she been doing silks or high level kind of physical
I want to
stuff?
say 6.
Okay, and she's like in her. Hopefully, she's okay with us telling her age, but she's in her like
40s,
late 40s, something like that.
Yeah.
So, I mean, she's in pretty good shape and stuff.
Yeah.
Athletic, like physically, she's in good shape, takes care of herself. But I mean, as far as the labrum goes, you got labrum in your hip and your shoulder. The labrum in the shoulder, it's kind of like a piece of cartilage, basically. It kind of helps, they say, like deepen the socket almost. Mm-hmm. So what it does is it keeps your shoulder in a good position, almost kind of suctions it there, and also has some lubrication and kind of the cartilage is nice and smooth to kind of allow your shoulder to the ball joint, the humeral head, to kind of move in the socket, but also kind of encapsulates the humeral head to kind of keep it, in that position. So when you're looking at
what type of joint, just real quick?
Glenohumeral.
Yeah, okay.
So glenoid is like the capsule, and the humerus is like your arm joint. So the humeral head is like the ball. Mm-hmm. So it's a ball and socket joint. So the thing with the shoulder is, I like to say that the shoulder has, it's one of those joints that has decreased stability and increased mobility. Mm-hmm. So because it's more mobile, there's more things that can kind of go wrong with it, I guess. So when you look at the shoulder, just in take a step back, it's not just your shoulder joint. You're looking at your glenohumeral joint, your scapular thoracic joint, so you're looking at like muscles that are coming from the neck to the shoulder blade, to the shoulder, like your upper trap. Then you have your deltoid muscle that kind of attaches all around there. Then you have your rotator cuff muscles that attach from your shoulder blade to your humeral head, different parts of your humeral head. So there's so much that goes into it. Then you have your clavicle, your collarbone, all that stuff has to move together and move properly for it to even function like it's supposed to not have compensatory patterns. So it's complex joint. I mean, it's not like when you're looking at the shoulder, you're not just treating the shoulder. You're treating all this stuff around the shoulder, you know. And then there's
the muscles of the shoulder joint, and then the muscles surrounding the muscles of the shoulder joint.
Yeah, and the shoulder blade and all kinds of stuff. So essentially, there's usually labral tears are categorized into two different categories. So you have a slap tear and then a Bankart tear. So if you look at it, say you're looking at a clock, okay, 12 and 6 is up and down, and left to right is going to be 9 and 3, okay? So a slap tear means superior labrum, anterior, posterior. So you're looking at, if you look at the clock, you're looking at 10 to 2. So kind of at the upper part of the shoulder, usually, you know, and I mean, the mechanisms of injury are different for a lot of people. It could be repetitive, could be traumatic, but if you do a lot of pulling, a lot of bicep, usually a slap tear, because a bicep, one of the heads of the bicep attaches into the labrum. So it's almost like if you do a lot of pulling or do something kind of aggressive, it's almost like peeling the labrum off of that glenoid. So that's kind of why the bicep a lot of times is a culprit in a slap tear, or the bicep may be released or reattached or whatever, or they limit, like the doctor will limit bicep function or like bicep curl, so bending the elbow for a while, because that can pull on the labrum and, you know, impair the healing process. So
so you're saying bicep is the culprit in this one typically? Well,
it's part of it. It's part of it. Yeah, exactly. Part of the problem. Okay. It's not like you don't always have bicep problems, but it's there. It's common. Yeah. Mm-hmm. So the other one is Bankart tear, and Bankart is, you're looking at 2 to 10. So it doesn't have to be those exact areas.
Bankart to
down to 10. So it's more the lower area. Now this depends on as far as restrictions and stuff like that. You know, when you're looking at surgical stuff, you're going to be, certain doctors have different protocols they follow. Okay. Usually it's a protocol of passive range of motion for a certain number of weeks, followed by assisted motion or active assisted range of motion, followed by active range of motion. Mm-hmm. Then you go into strengthening. But initially, you're kind of just trying to improve the motion of the shoulder, and limit the pain. You don't really want to stress the shoulder joint. You don't want to stress the repair. Usually about 6 to 8 weeks. The first 6 to 8 weeks out of a medical procedure, like a surgical, you know, procedure like this, you're looking at the healing. You're trying to not disturb the shoulder joint to heal it, pretty much.
So the immediate, of course, for this, and this goes to repair for both the Bankart and the slap, the first 6 to 8 weeks.
Yeah, say about the healing process about 6 to 8 weeks for the shoulder, just to heal from the surgery.
Now, is that going to include, like you said before, like does the 6 to 8 weeks include the passive range of motion and then the assisted active?
It depends on your age, and it depends on the severity of your tear. And the way they repair is they actually they'll suture labrum back in, or they'll put it back into position, and your tissue has to kind of grow around that and to get the labrum to kind of adhere back to where it needs to be. So, but every doctor is different. Some doctors are more aggressive than others. Some doctors
She's having some kind of bicep release done.
Exactly. So usually it's called a bicep tenodesis. Mm-hmm. So there's two heads of the bicep. One head attaches to the coracoid, which is kind of like a bony prominence at the front of the shoulder, and then one attaches to the labrum. Okay. What they'll usually do is they'll release that one. It depends. They'll release the bicep to where it's not pulling as hard on the labrum. Yeah. Okay. So it's called a tenodesis, where they basically take the bicep, they cut it, and they reattach it lower on the humerus. So the bicep isn't terribly...
It's interesting with the bicep, is attached to the labrum.
Yeah, it's crazy.
Seems like
I believe it's the shorter... I believe it's a long head. I believe it's a long head.
It would make sense. I feel like it would make more sense.
Yeah. So I believe it's the long head. So... But the thing is that, the bicep isn't even the main elbow flexor. It's not your power muscle, really. Mm-hmm. It does do some shoulder flexion, which is brings the shoulder up. But also, it doesn't do a ton of the work, I guess. Like, so your brachialis is your main power muscle.
When it comes to the flexion of the arm.
Yeah, exactly. So, but again, because that bicep can get tight, and if you're in a sling and stuff like that, you know, the biceps is bent. You know, the arm's bent, so the bicep's shortened. So, I mean, it's just kind of part of the issue. You know, part of it's not going to really. I believe it's a long hand. I'm pretty sure, but it's not that important, really. It's not terribly important in the function of the shoulder. I mean, it does do some supination, and which is like bringing the palm up as you bend the elbow. But so yeah. I mean, there's a ton of crap that goes into it for sure. So wanted to just talk about, you know, how do you know whether you have an injury? Like Terry had said, you know, she just had pain for a while in the shoulder. She did she have any kind of certain symptoms that you know of besides shoulder pain?
Just a lot of pain.
A lot of pain. She had clicking, popping, catching.
I have no idea. I mean, all I remember her talking about a lot has been the pain. Yeah.
So, like, some, like, obviously shoulder pain, you know, you can feel like pain in the capsule and the shoulder joint. You can feel like if you have a really bad tear, you know, you could have some of the tissue flipped over, some of the cartilage actually flipped to where, like, it catches in the joint and the joint feels like it's, like, rolling over something, or it gets kind of stuck. That's a really bad tear, and they can kind of flip, the cartilage kind of flip into the joint and then flip back and stuff like that. You can have, like, limited range of motion. There's a couple tests that your therapist can do manually to kind of assess, but those aren't necessarily the best, just because, you know, people can guard and you can have false positives or false negatives. But I would say the gold standard, and probably what your doctor will do if conservative measures do not help, is an MRI. So, and usually an MRI with contrast, or an MRI in general, but usually they'll do it with contrast, where you shoot the contrast dye. It kind of makes the shoulder pop a little, like they can really see the shoulder better. And MRIs are like the gold standard without invasively going in, but they're also not 100%. So sometimes they can look at your shoulder and see something that looks totally normal, but you're still having problems. So they end up doing like an exploratory, and they go in, they find a tear. And then sometimes they'll find something that looks like a tear, and they'll go in, and it won't be that bad at all. Or it may not even be a tear, maybe just a little bit of fraying or whatever. So the MRI is good. You know, usually that's kind of what they do before, but
as close as you're going to get to perfect
without them taking a scope and going in there and just start looking around, fishing for stuff. So, but you know,
something else that she did mention too, that they were going to clean up the bursa.
Right.
And so, and I didn't realize until she had said that, and I was like, oh, do you have bursitis? She's like, yeah. So, just quickly, for those people who may not know, what is bursitis? So,
bursa is generally like a fluid-filled sac. You have bursa kind of is subacromial space, so kind of right where the edge of that collarbone, or like kind of by where your shoulder is, kind of like the lateral, the outer part of your shoulder. If you're like lifting your arm up, you can feel like a little pinching sometimes, and that could be because the bone is arthritic, or it could be because there's a bursitis there. So a bursa is like a fluid-filled sac. It helps to lubricate, helps with cushioning, helps with kind of preventing, you know, compression on the area, I guess. So if you constantly aggravate or like push against that bursa, or you're moving it improperly, it can cause an itis, which is an inflammatory response. So that bursa can actually kind of get bigger and fill up that joint space and limit, you know, how far you can raise your arm up out to the side or in front of you. But so, and that can be something that's treated, you know, sometimes with a cortisone shot, which is more for inflammation, a chronic inflammation, or, you know, again, sometimes the doctors will go in, do a scope, and they'll clean out arthritis, or they'll clean out some of that bursa. So, you know, you can get like
clean it out. What do you mean by
Well, they'll like shave it. They'll shave it down, or they'll like, if you have like bone spurs on the like acromion, which is like that bone that sticks out, like kind of, it can go right over top of that bursa. Over time, you get kind of hooked and almost like act kind of like a saw. Like every time you lift your arm up, it kind of is like pinching or kind of sawing that tissue of like your rotator cuff, like your supraspinatus muscle. So that's definitely something, that, and again, if you have bad posture and your rotator cuff muscles aren't strong, it's not going to allow that shoulder to function properly. You're going to get a lot of that abutment of that humeral head, up against that bursa and against that acromion. So, yeah, I mean, that's something they'll usually go in and it's called like a subacromial decompression. So sub means below acromion, which is the bone. They decompress it by way of, cleaning out, taking some of that excess tissue or that bad tissue that is just not
inflamed and filling.
Yeah, and inflamed and taking up space that your shoulder needs to move properly. So, yeah, and I mean, some people will not have any kind of, they'll just have just general pain, achy. Some people have catching, some people have popping, some people have, joint pain. So limited range of motion.
Okay.
So.
All right. So 6 to 8 weeks of passive recovery, and
then a couple weeks of active assistive, which is moving with assistance. Then a couple weeks of active until you get full motion. Then you're working on strengthening, and that strengthening can last. It just depends where you're starting from and where you need to get to.
Okay. Now, as far as the actual recovery, so let's revisit that for a second. You were talking about starting with passive range of motion, and by that you mean taking the shoulder joint or the arm through the range of motion of the shoulder joint,
right?
With no effort on the part of the patient.
Usually, and it's hard to fully relax the shoulder because people are guarded, meaning they're protective. Your body instinctively protects the shoulder. So, and people are going to be in a sling. Probably, it depends. Some people are in there for 4 weeks, some 6 weeks. Every doctor is different. There's certain doctors follow specific protocols. Some doctors are like, you're going to be in the sling, passive range of motion for 6 weeks. You go to therapy 3 times a week. They're stretching you, moving the shoulder through its available range per comfort. You don't want to go through pain. People think a lot of times, the shoulder is a painful, the recovery tends to be painful more often than not, but you're not trying to provoke pain because that's your body telling you hey, that's what I got. You don't want to stress the repair.
Right, listening to that pain.
Yeah, and the thing with slow and controlled motion is you're going to know, you're going to feel the pain coming on or the stretch coming on. So it's not going to be anything aggressive, quick movement. So usually people are like, well, if I go to therapy, am I going to re-tear the shoulder? Well, if you have a bad repair, if your tissue's poor, if you're really old or diabetic or
aggressive therapist.
Yeah, that can happen too. But, usually you go fairly slow and you let pain be your guide. And a lot of times they'll give you restrictions like 140 degrees flexion, which is moving the arm forward, 140 degrees out to the side, or 145, and then maybe 45 internal rotation, which is kind of towards the abdomen and out away from the body with the elbow bend. So, it just depends. Some doctors don't give you restrictions. They'll just say, do whatever's comfortable. But, they want you to be pretty close in passive range within the 6 to 8 week mark. They want you to be pretty close to full range.
Okay.
And that's kind of the hard thing because, things you're looking at is some people can develop adhesive capsulitis, which is frozen shoulder because the tissue gets tight, or they're very guarded, or they're very painful, or they're not consistent with therapy. So it kind of depends on what you do.
Now, is there any particular, I heard you mention frozen shoulder, and that's something that I've seen on my table.
Yep.
From what I understand about it, and in this case, it would be a little bit different, but that most frozen shoulder is idiopathic, or it comes on.
It depends. Yeah, I mean, some people get it.
Meaning that we don't know what causes it.
Right. Sometimes it can be due to, just it comes on for no reason. Sometimes it can be due to an injury.
Right. Is there any specific demographic that it affects?
Yeah, I mean, that's a great point. They say middle-aged Caucasian females, in their 50s, why they're not sure exactly, but what it can be is hormonal changes and different stuff. So they've done a lot of studies as far as and they found things with women going through menopause, they have hormonal kind of issues. So
fluctuation.
Yeah, so those changes can, for some reason, cause adhesions, do whatever. But I mean, younger people can get it, older people, male can get it, but usually they say middle-aged Caucasian females. I don't know why, but that's what it is. And that's sometimes, therapy can take care of that. It's a long process, but also sometimes you have to have a manipulation of the shoulder, which is doctor doesn't really like to. A lot of doctors don't really like to do that, but they actually put you under and they take the arm through the full range of motion. They break up scar tissue and adhesions that they set in. So it is, but more often than not, people do pretty well with it. It's kind of a last resort,
Yeah. Well, it's forceful.
And some people just they resolve. It resolves on its own. With exercise,
I've seen that.
Consistency.
The majority of it is just literally an issue of time. Like
it can be. It can be, but
you work it and you help.
Yeah.
Try and release the tissue around the shoulder joint.
Yep.
And a lot of times I'll get reports of like it getting better after a session and it feeling better and being less painful and having some increased range of motion. But it definitely doesn't fix itself overnight.
No, and you think about what people do, if people live a sedentary lifestyle and they do a lot of driving or sitting, they're in that rounded shoulders posture and the shoulder joint's not a problem, like the ideal position, because if you're rounded, that kind of puts the shoulder joint kind of just not a good optimal functional position. So that's why having good shoulder blade muscles, having good muscles in this, like the low back around the shoulder blades to really keep your posturing and really hold that shoulder in good position so that the ball and socket joint can actually move properly through its range, because you'll see some people with shoulder dysfunction and it won't be really their shoulder joint, but it'll be more like their shoulder blade isn't controlled well. The muscles don't control the shoulder blade well. So the arm is just not able to function because there's not a stable base for the arm to kind of pull from. So
you said 6 to 8 weeks of range of motion, and then you gotta get into strengthening.
So then you go from like passive or active assisted range of motion, then you do like 2 to 3 or 4 weeks of active motion. So meaning, active range of motion can also be strengthening too, because you're actually moving the arm against gravity. So that can actually have a strengthening component to it. Yeah. You're concentrating on, using a cane or using the other stuff, standing, different positions of the body where you can, use the gravity as a, something for assistance or something as resistance, really. So it just depends. You kind of modify your body position to help you, or work against you or work for you, I guess. So then you work towards like rotator cuff strengthening and different types of exercise like Y's, T's, W's. You're working on diagonal patterns, rows, internal, external rotation with bands, with weights, really light stuff. Once you get really comfortable, good control with that, then you start working some, task-specific things, but you're just trying to build up that strength, that really baseline, that core strength, and you go from there. So it just depends as far as recovery goes. I mean, like pro athletes or whatever. I mean, you can look at somebody who has a pretty not terribly physical job. I mean, 4 to 6 months, or like if athletes, it could be 6 to 8, 8 to 10. It just depends on how you recover. Not everybody's going to recover at the same rate. So. I mean, it's just like I wish there was like one set time frame, like you're going to be back at this time, but there's no way to say it because you have to look at comorbidities or other medical issues, other stuff, diet, compliance with exercise. People really just aren't very motivated, or some people are overly motivated and they push too hard and they stress the tissue too much, and the tissue just constantly sore, and it's not allowing them to kind of do what they need to do. So yeah, it's a whole ball of wax, man. You're dealing with like the whole person, right? You're dealing with just the shoulder, not just the shoulder, but you're dealing with the individual, and they're dealing with stuff, and it's just a lot. It's a lot, and that's also mental. There's so much mental that goes into it, and that's one thing that when I treat like I'm treating so much of a mental side. And I think you see that in your practice as a massage therapist. A lot of what you do is mentally, like you're mentally treating people as well. And you almost wish you had more training in that aspect because it's such a component of it, you know?
It is.
Yeah, like why wouldn't somebody be compliant with this, or do they have other stuff going on? Are they stressed out, or?
Yeah, I think too that a lot of that comes from how they value or how they see the healing process. And unfortunately, in a lot of the just normal kind of Westernized medicine setup, and I think this is where you stand out, Eugene, is that as a physical therapist, you are actually like helping healing through the body's own capability to heal by stretching, range of motion. You're not really necessarily introducing a lot of external stimuli in the form of like medication. It's not your forte.
Right.
But the majority of people, they go to the doctor and their doctors have no discussion with them about their lifestyle, or very little discussion with them about their lifestyle. And when they get to these doctors and it's basically just, you know, oh, got high cholesterol, let's get a pill, you know, let's get you on some blood pressure medication.
Right.
You know, and it's just very like, oh, I have this problem and I'm going to go to the doctor and they're going to give me a prescription. It's going to fix me.
Right.
And so when you're raised in that, and that's where you've been, and that's, you know, even surgery is very like, well, you're going to have a problem and then we're going to go in and we're going to fix that problem.
Right.
And there's not a lot to do on the part of the patient from that model, but it is, your body when you're looking at it is very complex, and it takes a lot of effort on your part to keep it. In our society that we've created, you have to work constantly to keep your body in a place of health, you know.
Right.
And I think that makes it sound more exhausting than it actually can be, but it definitely is a lifestyle. So, that being said, I think you and I both see that a lot in our practices because of what we do, that we don't just deal with this very one small aspect of you know, an actual patient, but deal with their entire lifestyle and what they bring in. Yeah.
Yeah. No, I mean, like, for sure. And then, like, you know, if somebody is, you know, like I do Jiu-Jitsu, so, you know, even for me, not being able to train or being injured or taking time off is hard because you don't really it mentally beats you up.
Yes.
You know, if you injured, like I broke my arm, and so like, I was out for such a long time, and it's just like you do anything to get by, like you watch videos or you just sit on practice and you do something, but like it does screw with you. Like you're just like, what the hell? You know, like how do I? And then coming back, you know, it's a whole other thing. When you come back, you're not where you were, and you're kind of starting behind you know, a lot of people. Like maybe you were at the same or similar level. Like for example, if you're at Silks, you know, same thing. Like you building on these skills, or people are going to performances or doing stuff, and you're sitting out and you're watching and you can't do it, and you know, it screws with your head for sure. So I think that's like a big part of it. You know, do what you can. Like I think
well, I think it's easy to get distracted by that stuff too. I think it's really important, and one of the best things you can do for your sanity in a situation where you injure yourself and maybe you have to take time off of the thing that provides you with sanity, is to keep your eye on the prize, right? Like keep your eye focused and have people around you to hold you accountable and help keep you focused.
Yeah.
That's such a big thing, because it's like, yeah, it sucks that you have to let your body heal, and it sucks that you got injured. But if you don't do that, or you cut it short, or you cheat yourself on your recovery, you will continue to injure yourself, you know, down the line. And eventually it can get to a place where you have to say, I can't do this at all anymore.
Right.
And so it's like, if you want to still have this as an option and you get injured, you have to be smart about it. You just do. And that's where that mental focus and clarity comes in. And I always encourage people at least on my table, to meditate on those things. That meditation, just 5 minutes daily, the first thing you do when you get out of bed, make yourself a cup of coffee or a tea, and you sit in silence by yourself and you meditate on the one thing that you need to stay focused on. And it will just kind of help bring that into the forefront of your mind. Right.
I honestly, one of the most simple things for relaxation and, mental clarity that I think I do, and I do this on a daily basis. It's something I learned at work, or you work you have these little cheesy courses that they'll make you take for stress, and it's deep breathing. Deep breathing is so I think you tap into that kind of those relaxation centers or something. I just think it relaxes me and it helps me get back centered and focused. So I think deep breathing is so important, because people, whenever they're straining or stressing, they forget to breathe.
Right.
And that's
I think it's like tapping into that autonomic or nervous system.
Yeah, something like that.
It's very and I probably misuse that terminology, but it is very centering. You're right.
Yeah.
To the deep breathing. Also, I think there's just something to be said about trying to elevate the amount of oxygen in your body.
Yeah.
Just that we all tend to focus and function a little clearer when we are breathing in good, clean oxygen.
Yeah.
It just,
So I'm I'm one of these weird guys that you might see driving down the road. So I don't just want to drive down the road. I'll get one of those. I bought this, that Boss Rutan Inspiratory trainer, which basically what it is, this mouthpiece you wear, and you can put a nose clip in or nose clip on to kind of keep your nose from breathing. So basically what it does is trains your diaphragm to restrict the amount of air that you can pour. Yeah, resistance training for your diaphragm. Yeah. So you have these different colored or different sized little holes, okay, and you can put these little caps over top. And when you breathe in, the smaller the hole, the higher the resistance. So I'll sit there, when I'm driving, I will do deep breathing while I'm driving, and I feel like I'm working out my lungs a little bit, and I feel, it is a little bit straining. It's kind of working, but also I do feel more after I'm done, I usually do 2 sets of 12 breaths, and I go to max in inspiration, and then exert all the way, and after I'm done with a set, and I take a deep full breath and it's not restricted, I feel really relaxed. I don't know why.
Yeah.
I don't know. It's just deep breathing's awesome. I feel that's one thing you can do. Yeah. Well, yeah, and I mean, if you want to train longer, if you want to, roll longer in Jiu-Jitsu, or be up on the silks longer, or be doing
it. It's helped your endurance in that regard?
I think it has, actually. I feel because I'm training myself to breathe under a resistance type condition, I feel I can get deeper breaths and fuller oxygen. I don't know. Oxygenation. I don't know. Maybe it's in my head, but you know what? Maybe not.
Better not if it makes you feel better.
It does. I don't feel I feel I've warmed up my lungs and my diaphragm, and I concentrate on diaphragmatic breathing, which is basically it's a muscle that helps with breathing. And what I work on is when you're working on diaphragmatic breathing, when you inhale, you're trying to blow your belly out, trying to fill your belly up.
Yes, the idea of, I always, when I do diaphragmatic breathing, I always have this envision in my mind that I'm filling up the bottom of my stomach first, as full as it can go, and then that air travels as it's filling up all the way up to the top of my throat.
So when I have people do diaphragmatic breathing, I'll have them put one hand on their chest and then one hand on their stomach, and I'll watch them, I'll have them breathe in and try to belly breathe. So they're trying to expand their hand on their stomach, trying to get that to move, and limit the motion on their chest, because that means they're using other accessory muscles to breathe and not diaphragm they're supposed to. Right, and they're using upper traps and stuff like that. So, I mean, that's just important to do it that way, to breathe and keep oxygenated. Obviously, if you don't have oxygen to your lungs, then you're going to be feeling weak and tired. So, yeah, awesome. As far as return to sport and activity and stuff, we were kind of mentioning, as far as you got to have pretty full motion as far as jiu-jitsu is concerned. If you're can be put in positions like kimuras and arm locks and, have to be able to push off and all that type of thing. So, like, especially, in that and silks, I mean, like, range of motion is probably one of the most important components of, recovery. Because, I mean, if you have very limited motion but you're strong as hell, it's not going to do you any good if you can't lift your arm, past 100 degrees.
Well, reaching for things too.
Right, exactly.
So there's so much of this very, like, I have to reach in this very...
Like way behind you.
Yeah, way up and behind to get, to grab a hold of the fabric. And, yeah, if you're limited in any way, shape, or form when it comes to your range of motion in your shoulder, it's going to show up for sure. Yeah,
and so the other thing I feel like is really important to help with, recovery is actually warm up and cool down. Mm-hmm. A lot of people feel like, when they return, they can just hop right in. Like, you have to really gauge, how you get back into activity. You have to kind of go through the movements because the speed of the game or the speed of the actual activity is going to be different than, like, practice, So, like, don't go do a tournament right away or performance right off the bat, because you're not going to be ready. You have to really make sure your body's acclimated. You start building up that muscle memory and your body knows.
Well, also just the amount of stress that your body puts on your muscles whenever it's operating under higher levels of adrenaline is different, So
that's a good point, yeah.
It's like when you have higher amounts of adrenaline in your body, it will put a higher amount of stress on your musculoskeletal system.
Right.
And potentially generate also more force on those joints under those situations. It's very, very common.
Right.
So it's important to just remember, like, just from a not even from it's so, you can't separate the mental and the body, basically. If it makes you nervous going into a tournament, you get nerves before you go in, your adrenaline starts pumping, then automatically you're going to be in a position where it could, it could compromise you.
Well, you could be more tensed up too, so that's also an issue. I mean, absolutely, it's also an issue. So, like, I mean, there's such a whole other science to returning to sport, or coming back from an injury. There's such another huge component of it, so doing things like, diet and making sure you're hydrated and good warm up, good cool down.
Yeah, diet specifically being a really important thing to discuss. I think when you're in the process of healing, or you have an injury, you're already in a heightened state of inflammation.
Right.
And trying to help your body, what I would say is naturally trying to help your body fight inflammation. I'm not a big fan of taking over-the-counter anti-inflammatories. There are times and places for that, and I'm not a pharmacist, so I can't make specific recommendations on when the best times to take those things are. But I do know that they have negative side effects. I do know they're hard on the gastrointestinal system. I do know that they can stress the liver. And so I think it's really important also, too, that inflammation is a part of your body's natural healing process.
Yeah, I mean, you're bringing...
Truncating that seems like going against logic to me, that you would, instead of trying to just negate the inflammatory response, but kind of help get your body get through it faster to the other side. And so there are lots of natural things you can do, I think, to help just reduce your own internal inflammation. One of those things, watching your sugar intake, knowing that sugar has really been linked to high internal chronic inflammation. So always you need to watch your sugar intake, but especially when you're dealing with an injury, to make sure that you're not increasing just the general inflammation within your own body from your diet alone.
Right.
So there's that. You can also take natural, some kind of natural supplement to help with inflammation. One of those things that's been shown and has been studied, and there's been some great results come out of, is turmeric, and specifically the active ingredient curcumin.
Yeah.
Getting that through turmeric is one of, has been a challenge for a lot of people, I think, because turmeric is not easily absorbed through the digestive wall, or the digestive tract. So we've actually kind of been on this turmeric kick recently and just trying to figure out for us how to take it on a daily basis and get that in. And we found this golden paste that we really love. I genuinely feel like it helps me. I wake up in the mornings just from doing massage on a daily basis and climbing and silks and with tight, stiff fingers in the mornings for me to make a fist. And I feel like I've noticed a drastic reduction in that since I've been on the golden paste. So
you feel like you're stiff and you're not as stiff?
Not as stiff, correct.
Okay, so do you have like a recipe what's the recipe that you use? So there's a way you can take it, like take a couple spoonfuls or whatever, but there's also a way we take it in the morning. So let's start with what's the ingredients or what's the directions to make it? Like, how do we make it?
To make the golden paste.
Right, to make the golden paste.
So the golden paste is designed for better absorption. So a lot of people will ask, well, why can't I just take turmeric, or turmeric capsules? And there are a few, from what I've found, I think, and I don't have their names off the top of my head. There are a few brands that have invested in a curcumin capsule that you can take that is supposed to make it more bioavailable to you, easier to absorb.
Well, yeah, and they use the pepperine, which is like the active ingredient pepper, and they have like pepperine in the capsule. But I don't know how effective it is.
The capsule itself is designed differently. It's like a lipid-based capsule, I think. But anyway, so that's one way, and you can do your research if you decide that golden paste just does not work for you, and you need to find a way to take it easier. I would recommend either the second step, which we'll talk about after the golden paste, and that's what Eugene and I do, called golden shots. You can also do something called golden milk, which we haven't tried, but I do know that
sounds kind of terrible to me, to be honest with you.
It actually doesn't sound bad. It sounds really
nice.
You can look into these capsules.
What do we do with the golden paste?
Paste.
What's our...
So you're going to need... the supply list is going to be about, for one kind of cooking session, we do a half a cup of turmeric powder, which usually ends up being like one of those regular sized seasoning bottles of ground turmeric root.
Right.
And then you're going to need about 1 cup of water, a third a cup of raw, cold pressed, unrefined coconut oil, or you can use other types of oils. I didn't look at the other options on there, but if coconut is an issue for you, there are substitutes available.
Kind of like olive oil or something. You can use some other stuff.
Avocado oil would be my first suggestion, just off the top of my head. That would be a more stable one. I personally prefer coconut oil. It's solid at room temperature for the most part. Which means that it's a more stable fat, so it's not gonna oxidize in your system the same way, or break down into these kind of damaging free radicals the way that some of the oils that are liquid at room temperature.
Yeah.
So you need your turmeric powder, your water, your coconut oil. Third a cup of that coconut oil, and then 2 to 3 teaspoons of ground black pepper. And if you want to do more, do more. I think that more is not going to hurt you, but it does increase. The pepper is there to help increase the absorption of the turmeric, and so I think it's really important to not short yourself on that. Now, if you're sensitive to pepper, you do not have to put it in there, but it will help with the absorption of the turmeric. Now, you are cooking the turmeric and mixing it with a fatty base, the oil, the coconut oil, which those two things also help with absorption. So it is still better to take it as a paste without the pepper and cook it into a paste than it is to just take straight turmeric. So all of these things that you're doing to it are designed specifically to help your body absorb it. Because if you can't absorb it, it's not effective. So
I think what they said, the reason why you use like the oil, like the fatty type oils, is because it bypasses the liver and goes straight into your bloodstream. I think I read something that's why they use that. I don't know. That's what it said. It bypasses the liver and it goes straight to your bloodstream, so you get bigger, like more absorption of it. What's the other thing? How do you make your little turmeric shots? What do you do for those? Okay,
well, let's finish up with the actual golden paste recipe.
Okay,
so
cool.
That was what you needed. So what you're going to do is combine the turmeric and the water on the stovetop in a saucepan, and just over, medium heat. So you're not trying to boil it, but over medium to high-ish heat, you want to start getting that water to evaporate, basically, so you can cook it down. until you have a paste, and that usually takes about 7 to 10 minutes. If you've been cooking it at a high heat and that water's evaporating fast, you might have to add more water. But cooking it for 7 to 10 minutes, again, cooking it is part of the thing that makes it more bioavailable. So 7 to 10 minutes until you get a paste texture. Then at the end, you just flip that heat off, and then you add in your pepper and your oil, and you kind of whisk it in to get it all mixed in together. And it's going to make a kind of thick paste, and then we just put it separate it out into mason jars. And the one that you keep in the fridge will be good for about 2 weeks, so you don't have to, I would recommend doing smaller mason jars and then freezing the rest of them. So that way you can just kind of keep pulling jars out of the freezer as you go. So one batch for Eugene and I usually lasts for about, what you'd say, 3 weeks? Yeah. Something like that. So it takes, 10 minutes to make. Super, super simple. And it's really good for you. And not expensive, which a lot of these supplements are. So it's affordable. And like I said, I've noticed a huge difference. And if you look into curcumin, the benefits of curcumin or turmeric, there are a lot.
I say it's like, it's a natural anti-inflammatory, like we talked about, but also it's like fights certain types of cancers and stuff, which is crazy. It's like an antioxidant or something. So, but they say like you have to take it daily or a couple times a day, I think, because it doesn't necessarily last in your system and stay in your system that long. Right. So it's not something that you can take and then like not take for a week. Like it's something you have to be consistent with taking it. So. Yes. But yeah, like I've noticed, like, I feel better. Like my joints don't hurt as bad. And, sometimes with Jiu-Jitsu and gripping and a lot of stuff, my fingers will hurt, but I do feel like, I do feel better.
Good. So the way that we do it, I had mentioned earlier that there was a kind of a different way to take it. So we do make that paste, and then we take what we call golden shots in the morning. And that is, basically a shot glass with, a shot's worth of lemon juice. And we warm that up. So it's warm lemon juice and then a dash of cayenne pepper, a little dab, the smallest amount, literally less than an eighth of a tablespoon or like a third of a teaspoon or something like that, of raw honey, and then a tablespoon of that golden paste all mixed in together. And that cayenne pepper and lemon juice and honey is detoxifying, and it's good for you. It also has other benefits, but I'm of the mind that it would also help increase absorption with the cayenne pepper being extremely stimulating, and same with the lemon juice. So I just kind of came up with that because while the golden paste doesn't taste terrible at all, the taste isn't bad, but the texture is a little funny, and sometimes
it tastes bad.
Sometimes the texture of it really can throw you off, and so I just felt like, I wanted to take I used to do the exact same shot, but minus the golden paste, and then add in wheatgrass, and it came back to me one day, and I was like, well, what if we just... I don't have wheatgrass, but what if we put the golden paste in? That could work. So we've been doing it that way for a while now, and it's a great way to take it if you have a hard time with the texture, and then hopefully too the idea is that you will increase absorption. Right.
If you guys are interested, maybe Misha and I will make a video of us making the golden paste. Yeah. And we can put it up or put the recipe up. I think we searched somewhere online, found it. I think they use it for dogs. I think
you can use it for dogs, horses.
Yeah, it's crazy.
Cats, and also, different. Yeah, we just Googled golden paste. Right.
So we'll show y'all. I mean, it's been great. Like, it's super easy to make, and then we make like a couple batches and lasts us like a few months. Mm-hmm. So it's awesome, really. So we'll make a video on my YouTube channel or on the blog or a jiu-jitsu therapist. So we'll do that, and hopefully that helps you guys. I mean, stay healthy and keep inflammation down in the body. And I think it's anything like natural versus like something that's, made in a factory or whatever. I think it's like, your body's naturally absorbing it. It's not there's not really any known contraindications or any known issues, side effects. Yeah. Like, like for example, if you're doing ibuprofen, you have GI issues, or Tylenol can have liver problems, I believe. So, yeah. So, hopefully you guys, this helps. Hopefully, Terry, this kind of answers some of your kind of concerns about recovering from or having a shoulder surgery, which is, obviously any kind of surgery is major, but, obviously you want to do the most conservative measures first, in my opinion. I think therapy is beneficial even before surgery, even if you're going to plan on having surgery, just because they call it kind of quote unquote prehab, and the better your shoulder moves and the better your strength is going in, the better your function is going in, the quicker and easier and better your recovery is going to be. So, again, listen to your body. Some days you might feel like you can get after, some days you may feel like you can't, as far as rehab goes. And so hopefully this helps. Thank you guys for joining myself and Misha. And Mish, if they need to get a hold of you, do you have any kind of...
you can go to my website at www.massageatmeridian.com. You can also find us on Facebook, our Facebook page, Massage at Meridian. We're on there. And that also has on the website, there's a scheduling link and also a contact page. So if you just have questions or, general concerns and you'd like to reach out, you can do it that way. And it was great being back on.
Yeah, as far as just to add, as far as massage for maintenance and keeping your body healthy is super important to get a lot of that. We've talked about that before, but it really is a huge, huge benefit for somebody that's very physically active. Finding the right frequency of getting a massage is really a worthy investment. So I can't suggest it enough. I think it's definitely helped me a ton. So awesome. Thanks, Mish.
Of course.
Thanks, guys, again for checking out the podcast. Thanks to my wife, Misha, for joining me. And you can check her out at massageatmeridian.com. Also, their Facebook page, Massage at Meridian. And check me out, guys, at jujitsutherapist.com, on Twitter at jujitsupt. And check out my YouTube channel for exercises, stretches, and all kinds of injury prevention information at Jiu-Jitsu Therapist.